On this episode of the Ask Mike Reinold Show, we talk about pars, fractures, and athletes. We answer the question, or we discuss, do we really pay that much attention to limitations in hip internal rotation? And we give some pros and cons for the new kind of like online hybrid method for PT school. The Ask Mike Reinold Show. Helping people feel better, move better, and perform better. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. We are up in Boston, Massachusetts, champion PT and performance, MikeScaduto.com. Oh wait, I can always call it your name, Mike Scaduto. His name is Mike Scaduto. Yeah. Scaduto.com. And he has a website called MikeScaduto.com. You're like Dave. So we don't post edit these videos enough, but so Dave like adds the sound effects. Dan Pope, Fitness Pain Free. Dave Tilley, Shift Movement Science. Lenny McCrena, LennyMcCrena.com.
Police Academy.
.com. Yeah, you got to do that when after we say Lenny McCrena. You go .com. All right, we're gonna do that from now on. Let's start the episode over. No, I'm just kidding. Awesome. We're here. We have two fantastical. I'm gonna make up some words too.
Delicious.
Some whimsical physical therapy students here. We have. We're gonna start with Woody. What are you gonna start with? Woody this time. Sorry. We have Brooks Calvin Klein, also known as Woody.
Reach for the sky.
Okay, sound effect machine. What's that called?
Is there a snake in your boot?
There's a snake in mine.
Brooks is not doing it.
Brooks hates me.
Brooks Klein from UNLV. And we have Buzz Lightyear, right? Johnny LaRoof is on fire from Clarkson University, somewhere in New York. Perfect, fantastic. Take it away, boys. What do we have for questions today?
All right, good episode.
First up, Mike from Chicago. Hi, Mike and team. I have a 15-year-old high school freshman who plays football, basketball, and baseball. During basketball, he was diagnosed with a partial stress fracture of the pars interarticularis of L5. He was put into a hard back brace for 6 weeks, to be followed with 6 weeks of PT. What should we expect as part of the PT? Is 6 weeks of PT what you typically see for a stress fracture, and are patients normally released for full activity when done?
All right, so 15-year-old?
15-year-old high school freshman.
So 15-year-old pars fracture, 6 weeks in a brace. I almost said cast. 6 weeks in a brace, and then physical therapy. Dave, I don't know. This is kind of your wheelhouse.
Yeah.
How does prognostically? How does that sound to you? 6 and 6. Does that give you an idea that the physician may be thinking it's mild, moderate, severe, anything?
And just so I'm clear, it's 6 weeks brace, 6 weeks PT. Is that what it?
Correct.
Okay. So yeah, I think. Obviously, I treat a lot of gymnasts for pars fractures. However, that work has given me a lot more like hockey players and softball players, lately basketball players, and I think that I'm seeing a pretty similar parallel in the first 3 months. So I think that just as with all surgeries, right, the physician's conservative or non-conservative is based on their preferences. So like I've had people get braced for 4 weeks, 6 weeks, 3 months, 4 months. It really depends on the preference, and it also depends on the severity of the fracture. So if someone who's very proactive and as soon as their back started to get sore, they got screened and went to the doctor. That just happened with an athlete last week. 4 weeks in the brace, just because it's like a stress reaction, just started to actually fracture the pars. Versus, someone who's trying to be a hero and play through their season, which was another athlete that we had. She was in a brace for a full 3 months. It was like no exceptions, right? And I think that has to do with the amount of slippage forward of the vertebral body, because obviously neural issues. So I think it's really going to depend on the athlete, their position, their goals, how long they've had pain. But the 3 month timeline typically has to do with the bony healing itself. They'll do a PET scan, a single scan PET scan or something else, and based on pain, they'll re-scan them at 3 months if they're still painful. But usually people heal within 3 months in terms of the pathological fracture. So I think it's normal. I will say that the PT prescription for these types of injuries, I think, is a little misguided. I think one, they usually are overly aggressive in how many times per week they need to be seen. Sometimes you need to be seen 3 times a week, for the first 4 weeks. And I think that's unfortunately it's a little aggressive because there's not too much you can do with them. If they're healing, you can clear up shoulder and hip stuff, but I also think that I'd rather go less frequently and longer duration, because these athletes often get really left behind in the advanced strength conditioning. So I think they get back to pain-free back and their hips and shoulders a little bit more mobile, and then they're like, all right, good luck with sports. and the athlete that I was just talking about went to go swing her bat the first time, and nobody had done advanced strength conditioning, and she, really hurt herself. She didn't refracture, but she really like banged herself up. So I think, that's kind of my thoughts. I guess that sums it up.
Yeah, that's a heck of a summary.
This often happens.
That answer brought to you by Starbucks. I mean, fantastic answer, obviously, but the other issue though is in those 6 weeks. Yes, there's things like, Dave kind of said shoulder and hip and stuff like that, but look, there's probably a reason why you got here. You're probably hyperextending your back somehow. In rotary sports like baseball, maybe your hips are tight and you're over, rotating your back or something like that. So in those 6 weeks in PT, you gotta, potentially identify any movement restrictions, mobility concerns, something that may be influencing extra stress on the back. Maybe it's poor anterior core control and they're getting excessive extension, those types of things. So those 6 weeks are super important, but as Dave said, the real work probably starts when it's after. So is it realistic, I guess, to kind of come back to answer the question, is it realistic to be back in 12 weeks? Yeah, if it's mild, it certainly could be back in that program if it's mild. But if it's significant, then the scans are probably going to not be good and you'll probably not be allowed to play. Make sense?
Yeah.
Yeah, I would say so. Good. What's next? Buzz, you up? Buzz it up, Buzz.
Dr. Man.
Alex from Long Island. How concerned are you with restoring hip internal rotation, or do you attribute a loss of range of motion to differences in bony anatomy and structure? Do you find that a lack of hip internal rotation increases injury risk?
All right, hip internal rotation. This is probably a good one for Dan. Maybe Dan would take this one a little bit here, and then maybe Mike, you can chat maybe about the golf swing or something. That's something that Mike's good at here. But hip internal rotation, if they're limited, do we work on it, and is that limitation even an issue?
Yeah, I guess it really depends on the activity that people are trying to get back to, I think the concern is that I see people that try to go into a very deep squat, and then when people are trying to go into a very deep squat, if they have, let's say, a cam deformity, that might change the amount of internal rotation, range of motion you have, decrease the ability to squat with the toes straight ahead, and that's going to make it hard to do things like Olympic weightlifting. So we see a ton of that, and a lot of times that reduction in range of motion could be attributed to a cam deformity. I know there's been some research that shows that if you do have limited internal rotation, that correlates pretty highly to having a cam. I just read a study the other day that showed the opposite, that there was no. So it's kind of hard to say. I think there probably are.
There was no relationship between internal rotation and a deformity?
Yeah.
And so people could be tight without a cam deformity?
Yeah,
Gotcha.
for sure.
Yeah, which totally makes it. The cam deformity is that's secondary. That's, you know what I mean? That doesn't mean you have an anatomical alignment issue, but anyway, yeah. No, that's interesting though.
Yeah, I think the concern comes when people are limited with range of motion at the bottom of a deep squat, and that's coming from a bony deformity, and then people are trying to gain that range of motion back when really it just might be jamming up against bony anatomy and maybe even making the problem worse.
Right.
So I would say it's challenging for us to screen that, but things like Craig's test, if you do have an x-ray available, people have a history of a lot of pinching in front of the hip. I wouldn't continue pushing that if it continues to hurt. I'm just careful with it, and I don't try to improve that internal rotation, range of motion aggressively. If people are squatting appropriately, they have the right depth, their technique looks good, they're reaching their goals, they're not having pain. I'm not saying you need to increase your range of motion in your hip, otherwise you're going to get hurt in the future. I don't think that's
That doesn't necessarily correlate.
Yeah.
What do you guys think? I mean, is the hip that kind of thing? Is if you're limited in hip internal rotation, is it because a muscle's tight?
I don't know. The end feel seems pretty bony to me, and so I don't really.
Almost always, right?
Right. It just feels like this firm, end point. And if it was a shoulder, I wouldn't crank on the shoulder to try to improve that motion. So I use the same principle for the hip. So I just work on maximizing soft tissue mobility. So glutes, adductors, low back. Try to get that feeling a little better, maybe moving a little better, so to speak, and then just strengthen those areas. But I don't know. I'm not gonna. Crank. I've been seeing stuff on social media, people cranking on hips trying to improve internal rotation. I'm just like, man, I feel like that we're going down the wrong road with that one. Where I think we're doing more harm than good with those people.
I feel like the pendulum is swinging here, and it's probably swinging in a bad direction.
Yeah.
That we're doing too much hip mobility.
Yeah.
Like Lenny said, I mean, you go online now, everybody's doing hip mobility drills. Everybody's getting the hip to end range of motion and trying to get more motion, jamming it, which really osteokinematically, arthrokinematically, it really makes no sense.
Yeah.
Right? Especially in a hip joint like this, like you certainly. That's a challenging thing. You're getting them all the way to the end of bony alignment and then trying to jam it into more. So you're actively pushing them past their passive restraints. it's not going to end well, I think, in the long run. I think the pendulum's going to shift back a little bit. We're definitely overstretching that. But, Mike, any difference in golf, or what do you see? I mean,
I guess like everything you guys touched on, completely agree with. In the golf swing, you definitely need hip internal rotation some amount, especially on the lead side as you come through impact and into follow through. It's super important to be able to rotate over your front leg, and that's internal rotation of the hip. So that's done in a weight bearing position. So for me, I think we usually test like hip internal rotation at 90 degrees of flexion, open chain. I think it's important to assess in closed chain in more of a golf posture. There's some research that shows like golfers' self-selected driver stance tends to give them the most hip internal rotation, so they have the most available range of motion in the position. So whatever degree of hip flexion that is, people tend to be able to find that. And over the course of a round, they tend to stand up and come into more relative hip extension, and then they begin to have less available hip internal range of motion. And that's been shown to be correlated with hip pain, like low back pain in the golf swing. But it's really just changing that amount of available hip range of motion, and that's usually from some kind of fatigue. As it gets later in the round, they get tired, tend to stand up a little bit more. So I tend to look a little more big picture on that, kind of see.
well, it sounds like in a golfer too. Maybe you have an older individual. Maybe they do have some just tightness from being in there. But I said that group would probably benefit from just some stretching, self-myofascial release type stuff like that. So that would help them. But I feel like the pendulum is definitely swinging towards we're doing way too much.
Get it?
I'm gonna say something real quick. I don't want to belabor the point too much.
Oh, swing. Yeah, I get. No, I didn't get it.
I know we already spent a lot of time on this, but one of the things you guys really taught me is that kind of like the sleeper stretch. You have someone who's throwing constantly and they have a irritated shoulder and rotator cuff. Last thing we want to do is put them in a position that's potentially going to make them more irritated. I think the same thing is happening when you see a lot of Olympic lifting athletes, powerlifters, you see a lot of CrossFit athletes. What they constantly tell me all the time is like, yeah, the front of my hips are always tight. They're tight, 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 which is similar to the same thing. I stretch into this position, I feel tightness in the front of my shoulder. Is that really tightness? I don't know. And part of it is that if you're stretching to more internal rotation, you might just be irritating something that's already irritated. So maybe there are better interventions for an already aggravated hip, just like the shoulder.
So I guess to summarize, I would say we really don't emphasize that a ton, right? I mean, if you have some significant issues, like, yeah, sure, we'll definitely address that. But I would say more so than not, we're probably not, right? We don't emphasize that as much as Instagram does, right? Maybe we'll leave it at that. So we got one more?
One more.
Is that 3? Good. Brooks, what do you got? Woody?
Paul from the Bronx. Hi Mike, I am a traditional student looking to start DPT school next year. I was wondering what your thoughts on online hybrid DPT schools were. There seems to be a few big name research institutions who have started this the past few years, and I am seriously considering this option. What are your thoughts?
So we started talking about this online hybrid PT schools. We're doing this for athletic training too, and we kind of talked about that because we have some past students that have gone through programs like that. I don't know, what do you guys think? But maybe we'll briefly go through this one. What are the negatives of that? Remember online hybrid, let's assume that they're obviously they have clinicals, but they're also doing their hands-on. I think they go there and do hands-on and taking the class online. Let's start, Mike?
I think one of the biggest drawbacks for me, I recently graduated from Northeastern, and being just in an environment with my classmates, kind of problem solving and like learning from them and collaborating, and then keeping in touch with them after graduation, kind of seeing where they're working and bouncing ideas off them, and kind of have a communication back and forth. So I think it's the relationship that you build in PT school with your classmates, and that may be lacking in the hybrid model.
That makes sense. Even just like you said, the problem solving, the studying together concept. It's actually a good call. You guys go to Snell Library a lot?
No, we got together recently for a big game, and we all hung out and kind of caught up. But yeah, we studied at Snell.
Mike was looking for a new job. I like it. That's what I'm hearing. Right there. What do you think, Dan?
Well, I think there's probably going to be some pros. I guess I'll start off with some pros now that Mike did a bit of the con stuff. I agree with Mike for sure. The one thing I will say is I'm a big self-learner. I love learning on my own time,
me
learning
too.
when I want to.
Me too.
And that's a big thing for me. And obviously it's nice to have a good schedule if you need it and go to class at these times. But The other piece is that, let's say you're busy, you don't have the finances in order to make it to a big institution. It's going to be a little bit easier potentially for you to do something that has some flexibility, some ability to do some stuff on your own. And potentially it's going to be cheaper. And to be honest, it's so expensive with physical therapy school anymore that I think it's a very viable option for a lot of individuals.
Yeah, and you can work a little bit
You
too.
maintain
Yeah.
a full-time job.
Yeah, you could definitely do full time. That sounds awful, but you
Yeah,
probably,
it sounds brutal.
you probably could. So that's actually two good ones right there. So like Dan's more like of the introverted learner, right, where he wants to learn on his time and by himself. And I would agree, I'm like that. I think I would do the same thing. Mike's the social butterfly, right? That needs other people.
So ironic.
Needs other people telling him how or not telling him to discuss like how to like problem solve through something like that. And I can actually see that. I feel like some of the subjects that I went through in school were definitely somewhere I preferred to be in a group because maybe I just struggled with grasping it or something like that. But then Dan, so well, it sounds like there's pros and cons out there. I don't think we're going to be able to give you the answer, but I think the biggest take home maybe from us right now is that we don't think it's a bad idea. There's just pros and cons, and I wouldn't be surprised if that's the future and that's what we start doing more and more of. So I think it's going to come down to where you do your clinicals and you get good clinicals to get your hands-on skills, and you do the book smarts with stuff like your statistics class, right, and like your research class. Like you don't need to be in a classroom for that. So awesome. Well, thanks guys. Appreciate all the great questions. Good ones as usual. Thanks so much. Go to MikeRound.com, click on that podcast link, and you can ask us questions online. Be sure to rate and review, subscribe to us on iTunes and Spotify, and we will see you guys on the next episode. Thank you.